For our HEMS and retrieval partners that we work with, and for those that are looking at what solutions are out there in the market, there are a few key elements that are really important to consider in a platform. The first is obviously the patient care reporting. That's the end goal, the end output. And it's being able to ensure that you can capture that information in a systematic approach, in an approach that makes sense to your organization and it has that flow. So it needs to be configurable and it fits around what you're delivering, where you're delivering it and how you're delivering it. It needs to be able to work offline, recognizing that at all of your operations, you have periods of poor connectivity or no connectivity. And it's about the output. What does the end documentation look like when you're sharing that with another service or at a receiving facility? But the other side to that is also around your mission management. There is the documentation, which is important, but it's about how are we capturing the missions that we're responding to? How are we understanding what is the crew components? How are we capturing these other data points? And when you have it all in one system, such as the Chronicle and MedStat system, which lives as one single solution, you have this end-to-end piece between being able to capture the mission details, the mission planning, the mission execution, all the way through to the clinical documentation around the care that we've delivered to our patients. And so when you're looking at these different tools, it's not about saying, I want a mission management solution or I want a patient care solution. It's about understanding that this is one and the same and it's interconnected. Now, there are different parts of the team that deliver these components, but it is all one end goal for our patients. It's about looking at how do we bring in our geospatial elements? Where can we see where our teams are? Understanding how can we protect those teams and know where they are so that we can be informed from a coordination perspective. But also it's about the data at the end of the day. It's about being able to bring these different points of reference together, being able to correlate them and understand it so that we can improve our patient outcomes and create better patient outcomes in how we respond and how we manage the sickest patients.